Well, 5 new measles cases have been reported by the Indiana Department of Health. That brings the total to 6 in the state. The new cases include 3 minors and 2 adults in Allen County, the same area where the initial case of an infected minor was reported. Indiana joins a number of states reporting outbreaks. Nationwide, 2 children have died and hundreds are affected. For more, we're joined now by public and environmental health expert Graham McKean. Welcome back to the show. Nice to have you.
Thanks for having me, Joe.
So, a lot of what we're hearing right now is there's kind of a common theme, and that was they were unvaccinated. So how important is it to be vaccinated?
Well, clearly it's very important. It's the most important measure, not only for the prevention of measles, but also to boost community immunity and to protect your own immune system, because infection with the measles virus can actually cause immune amnesia, can wipe out your immune system's memory. So 1 dose is about 95% protective, and 2 doses about 97%.
So were most people vaccinated as children? And then how would you know if you're not vaccinated?
Yes, most people were vaccinated as children, going back several decades as it was required in many schools. And if you don't know, you could contact maybe your provider if they're still around,
right,
or your school system, or the local health department, the State Department of Health. But in most all cases, if you were vaccinated fully as a child, you are still protected today, and a booster would not be recommended.
Okay, so I was going to ask, is there a booster?
There could be in certain situations, and there has been certain situations where they've used them. Now, if you were born before 1957, they don't recommend any vaccination because they assume that you had measles previously. And then if you were received a vaccine between 1963 and 1967, there's a small chance you might have gotten an inactivated vaccine and might be recommended for a booster in that situation.
So how contagious are the measles?
Measles is the most contagious disease in humans, full stop. A single case of measles in an unprotected population, an unvaccinated population, would generate 12 to 18 additional cases. If all of us in this room were susceptible to measles and one of us had measles and was infectious, 90% of us would get it in this room. It is that contagious. It is airborne as well, and it has really good ability to stay suspended in the air and can be in the air for up to 2 hours after somebody leaves a room with measles.
So is that why, I mean, it's serious, it's really important to take these outbreaks seriously then?
Exactly. This is very serious. This is not benign. There's likely a lot of underreporting as well. And it's the law of large numbers because it is so contagious. 1 in 1,000 or 1 in 2 out of every 1,000 cases will get a severe encephalitis or die. You might have pneumonia or blindness as well. So there could be some crazy and concerning complications with this. 1 in 5 children will be hospitalized as well. And so in addition to that damage of the immune system, I really feel that these outbreaks are harbingers of what's to come and what's happened with public health since 2020.
Yeah, there's been a lot of anti-vaccination messaging maybe going on, especially on the right, up to the federal level. How frustrating is that to you as someone who does this as a living?
Well, it's extremely frustrating, of course, but it's also really sad because I believe a lot of these people are not pro-disease, and I think it really shows how much trust we've lost in the public health system. And so, these measures are safe, they're effective, they protect the vulnerable, they prevent disease and death, they reduce costs, they save us money, they reduce burden on the healthcare system, so why would you not be against that? And so I really think we clearly need better public health leadership, we need better, clear public health communication, education, and public health advocacy. I think public health innately is political, but we've always kind of stayed out of it. Public health needs to be more political. Public health needs a lobby.
Graham, thank you so much for being on the show, really appreciate it.